name's Sophie. I'm a student paramedic. Just confirming that your date of birth and your name.
Yeah, 10th of the 9th, 96, and Sophie Brown Mason.
Perfect. Okay, so I'm going to be doing a cardiovascular assessment on you today. So that's going to involve me having a listen to your chest, feeling your pulses, and a quick feel of your abdomen. Is that okay?
Yep.
So just before I start, have you got any pain anywhere?
No.
Okay, so I'm also going to have to get you to remove your shirt, if that's all right.
Yep.
And I'll get you to lie at a 45-degree angle too.
Yep.
Awesome. Okay, so just getting a quick overview of the patient, having a look at their bedside, if there's any medications such as GTN or oxygen, any mobility aids, and having a look if the patient is looking in pain while they're at rest, if there's any shortness of breath, and looking at the general pallor, are they looking cyanosed or have they got good perfusion? So looking at the face, if there's red cheeks, that could indicate malar flush, or which could indicate mitral stenosis. Moving down, having a quick look at the chest, any obvious signs of scars or palpitations. Moving down, having a look at the legs again, looking for scars of previous harvests, looking if there's any pitting edema in the ankles, any limbs have been missing, or if there's any missing toes. If this patient had chest pain or shortness of breath while they were at rest, and had a 12-lead ECG done which showed a STEMI, then they would be classified as a status 1 patient, as this poses a direct threat to life. Okay, so I'm just going to have a look at your eyes. If you would just be able to lift down the lower lid. So I'm just looking for any conjunctival pallor, which could indicate some anemia. I'll also have a look around the iris. If there's any yellow or grey discoloration, a ring around there, that could be corneal arcus. And also just looking around the eyes, if there's any yellow lesions, that could be xanthelasma. And now moving to the mouth. So looking at the lips, if they're blue, it could indicate that they're a bit cyanosed. And would you be able to just open your mouth and put your tongue to the roof of your mouth? Perfect, thank you. So also again, looking there for any cyanosis. Now looking at the corners of the mouth, if the patient is low in iron, it could be a bit inflamed around there. And finally, assessing dental hygiene. Just can you open your mouth for me, please? So dental hygiene can be a sign of endocarditis if there's any tooth decay there. Okay, so I'm just going to have a look at your hands to do an assessment. So first the nails. Have a look at any splinter hemorrhage. So is there any red or brown streaks on there? And now I'll have a look for any clubbing. So could you hold your fingers up like that for me, please? So I can see a little diamond-shaped window, which wouldn't be present if she had clubbing presently. If you can just flip your palms over for me, please. So having a look for any red lesions or bumps or anything like that. Having a feel for the temperature. If they were cool, that could indicate hypovolemia. Feeling if they're clammy or sweaty, that could indicate an acute cardiovascular event. Also having a look at the fingers for any tar staining, any yellowness, which could indicate she was a smoker, which could have effects on her cardiovascular system. And having a look for possible signs of xanthomotor. So are there any raised yellow lesions around the wrist area? They would be present if this was the case. I would also assess the patient's capillary refill just by gently squeezing on the tip of the finger and waiting for the colour to return. In a normal person, this should be under 2 seconds. If they are compromised, then it will take longer to recolour, which could be a sign of hypovolemia. Also having a look at the general colour. Are they looking a bit blue and cyanosed? That could indicate hypoxia. Okay, so I'm just going to have a more thorough look at the chest. So just again, assessing for any signs of previous surgeries, such as cabbage, seeing if I can see a pacemaker up there, and looking at the general picture, seeing if there's any deformities in the chest area. I'll also assess for any obvious signs of pulsations, which could be as a result of hypertension. Okay, so now I'm going to assess the jugular venous pressure. So if I could just get you to turn your head away from me for a moment. So we're just assessing the jugular vein down here. So we do this using the hepatojugular reflex, which involves pressing on the liver, assessing for any rise. In a normal person, this rise should not be more than 4 centimetres and shouldn't last for over 2 cardiac cycles. If it does last for a while and is quite distended, it could indicate cardiac tamponade and excess fluids in the body, along with other conditions. Okay, so I'm now going to assess your pulses. Let's start with the radial. So we'll get a rate and regularity and see how strong it is as well. I'll also compare with the other side. In a healthy person, they should be pulsing at the same time. I'm now going to assess for a collapsing pulse. So I'll feel the pulse and at the side, and I'll now raise it above her head and see if there's any impulses in this area of the muscle. Okay, thank you. You can put that arm down now. I'm now going to take your blood pressure. I'm assessing for hyper or hypotension. So if it's above 140, that's classed as hyper, and under 90 is hypo. Feel for your brachial pulse, so up here, assessing that for strength and regularity as well, nice and strong. And now your carotid pulse as well. Assessing that again for regularity and strength. And with the blood pressure, it would be ideal to take it on both arms and when the patient is lying down and standing up to see if there's any postural changes. If you find that they do have a significant dysrhythmia, which is causing severe cardiovascular compromise, then the patient will be classed as a status 1, as this is a significant risk to life. If a patient has dysrhythmia which is causing mild cardiovascular compromise, then they are classed as a status 3, as this is an unlikely cause of death and they are not necessarily time critical. Okay, so I'm just going to palpate your chest if that's okay. So firstly, I'm going to assess for any heaves, which can be a sign of ventricular hypertrophy. So we do that on the left sternal edge, and just feel there. Now I'm going to be assessing for thrills, so feeling if there's any palpatable murmurs there, and on the other side too. I'll now assess for the apex beat, which is on the 5th intercostal space. So 1, 2, 3, 4, 5. It's obviously a bit harder to assess on women, but it's down on the left side in the 5th space there. I'm now going to auscultate your chest. So first I'm just going to start off with palpating your carotid artery to find the first heart sound. I'm then going to go to the aortic valve and listen to that. The pulmonary valve, they're both in the 2nd intercostal space on either side of the sternum. And then down to the tricuspid valve, which is on the 5th intercostal space to the left of the sternum. And the mitral valve, which is also in the 5th intercostal space, in the centre of the chest. I'll then re-listen to those with the bell end. Okay, I will now auscultate the carotid artery while she's holding her breath. So is it okay if you just take a deep breath in and hold it for a few seconds for me? And the other side. Thank you. And now I'll do the left axillary line. And finally the left sternal edge. And the mitral valve is also where we could feel the apex beat before. I'm just going to perform some accentuation manoeuvres. So if I could just get you to please lie on your left-hand side. And I'm just going to listen to the mitral area. So if you could just take a deep breath out for me, please. And again. Thank you. And now if I could just get you to sit up and lean forward. Now listen to your aortic area, again on an expiration. So another breath out, please. And one more. Thank you. I'm now going to listen to the back of and the base of your lungs, just to see if I can hear any crackles, which might indicate pulmonary edema, which is left-sided heart failure. Thank you. So with the pulmonary edema, that's obviously as a result of the left-sided heart failure. Previously, when I was assessing her feet, I was looking for any pitting edema, and that is as a result of right-sided heart failure. As this patient has no positive signs of any cardiovascular deficit, there is no obvious signs of immediate threats to life, so they're classed as a status 4 and are not classed as being time critical. So that was my cardiovascular assessment. Just for further tests that would be required, I would suggest to do a full peripheral vascular examination, acquire a 12-lead ECG, do a urine test, and test the BGL. Before and after touching your patient, you should always wash your hands as well. Thank you.